So next I'm going to assess your anterior chest, abdomen, and then we'll move on to your lower extremities. So the first thing I'm going to do is I'm going to inspect your chest, and everything appears intact. Skin is warm and appropriate for her ethnicity. She has regular, non-labored breathing. She doesn't have any retractions. Don't see any abnormalities in her breathing. So now I'm going to listen. Okay. Her lungs sound clear throughout the right and left lobe. Next, I'm going to palpate for any thrills, lifts or heaves. I don't feel any. But I can feel the PNI. It's pulsating at a regular rate with a +2 amplitude. Okay, now I'm going to listen to all your valves. The aortic valve is at the second intercostal space on the right side. Pulmonic. At the second intercostal space on the left side. Irv space is the third intercostal space. Tricuspid is the fourth. And mitral is the fifth. Okay. I don't hear any thrills. I don't feel or hear any thrills, lifts, or heaves. I'm now going to listen to the apical pulse for 1 minute. So her rate's 80 beats per minute, and it was regular. I'm now going to listen with the bell. to do is an abdominal assessment. First I'm going to look at your belly and make sure that there's no scars or gross abnormalities, which I don't see. Her belly's round. I don't see any extra movement or pulsations. Then I'm going to listen in all 4 quadrants for vowel sounds. I hear normoactive vowel sounds in all 4 quadrants. I'm first going to perform light palpation for any tenderness. Any tenderness when I do this? Okay, and then I'm going to perform deep palpation to check for any masses. I don't feel any masses in any of the quadrants. See if I can palpate the liver border. Any pain when I let go of my hand? No. There's no rebound tenderness, and I'm unable to palpate any enlarged liver. The next thing I'm going to do is I'm going to percuss your belly. And I heard tympani in all 4 lobes, or all 4 quadrants of the belly. The next thing I'm going to do is I'm going to check for bruits. In the aortic artery. In the renal arteries. And then in the femoral arteries. None of which are present. The next thing I'm going to do is I'm going to check for a hernia. So if you could put your arms behind your head and lift up. And I don't see any evidence of a mass or anything protruding that resembles a hernia in her abdomen. So now I'm going to move on to the lower extremities. Down here. So yeah, if you could turn just a little bit. Okay. So the first thing I'm going to do is I'm just going to look at her lower extremities. Let's see. You just get back in the bed then so that your legs are on the bed. So I'm just going to look. I don't see any scars. Her legs are warm. The color's appropriate. I don't see any varicose veins. I don't see any edema over bony prominences. Everything appears to be normal in that respect. I'm going to check her pulses. So her pulses are present, they're regular. they're also present regular with an amplitude of +2. I'm going to check for cap refill. Cap refill is brisk, less than 2 seconds, so that's good. And then this doesn't necessarily apply to her, but if this was a male patient, I would inspect his penis and scrotum for hair distribution and skin characteristics. I would palpate his testes, noting any masses or lumps, tenderness, or any abnormalities. I would inspect his meatus for a location of it and if there was any discharge. And then I would make sure that his testes, his epididymis, and vas deferens were normal for size, tenderness, and to ensure that they didn't have any masses. I would also educate them on monthly testicular self-exams, which should be performed monthly when they get out of the shower in front of the mirror, and that they should just palpate their scrotum and testes regularly for any lumps or masses, tenderness, or any abnormalities.